Hi everyone, it's Dr. Ellern here at Reflection. I'm a cosmetic physician and today we are talking about Clear and Brilliant. So Clear and Brilliant is one of my favorite treatments. It is a fantastic treatment, super well loved, and absolutely if you've never tried a laser before, this is the laser to try. It is generally used for kind of two different dynamics. People with fine lines, brown spots, we do it a lot for melasma. Also for age groups where they don't have a lot going on, like myself, where you have maybe a little bit of sun damage, a little bit of lines. There's two different hand pieces on the Clear and Brilliant. So when we're deciding which one to use, we're kind of looking at what problems are going on with the skin that are bothering you and your skin type and deciding our settings based on those. There's the 1927 handpiece, that's the Premea. That is primarily used for pigment-based issues, melasma, sunspots. You do get a little bit of pore refinement and fine line refinement with it, but it's more geared towards that pigmentation issue. The other handpiece is the 1440. That is the original handpiece. That is geared more towards fine lines, pore size, deeper issues. They feel somewhat similar in terms of the sensation during the treatment. Downtime is probably somewhat similar as well. When we are looking at those handpieces, each of them has a low, medium, high setting on them. We adjust the settings based on your pain tolerance. If you're feeling like it's too much or too little, we can turn this up or down. And we also adjust it based on skin types. We are able to do this on any skin tone of skin without issue. Obviously, we want to be a little more cautious if you have more melanin in your skin to prevent any post-inflammatory hyperpigmentation risk. However, this treatment is very safe and really has not shown me that it has really much of that to worry about. So we are really excited to offer this as a treatment to you, and we look forward to coming in and seeing what handpiece we would need to use for you and what treatment would work best for you off of your face. We hold off on any aggressive topicals during the few days prior to, like retinols for a few days prior to treatment and a few days after until you're fully healed. It will give you a nice, refreshed, rejuvenative appearance. These are done as a series. Generally, we're recommending around 3 to 4 treatments a month apart to help reduce any of these brown spots or fine lines that you are experiencing. The question always becomes, how frequently do we need to do this laser to maintain the effects that we have accomplished? So that answer does lie in a couple different factors. If we are talking about melasma is something that recurs. So most people who are doing melasma are either doing maintenance treatments every couple months or doing a series like usually every fall, winter time to just keep that pigmentation that really wants to come back at bay in addition to their topical regimen. If we were talking about sunspots and anti-aging as more of a preventative and improvement, that may be somewhat similar where you're doing a maintenance treatment after your series every couple of months, or you could space it out a little bit more and do that series every year or even a little bit less frequently depending on the other treatments you are doing outside of this. So we kind of customize the approach. I think the important part is whenever we're talking anti-aging, we have to address the fact that we are losing collagen every year. And in order to see an improvement in your skin over time, you do need to do some treatments on a regular schedule. That may be this treatment, this may be microneedling or radiofrequency microneedling, it may be a more aggressive treatment every couple of years. Those will keep you looking younger for longer, in addition to sun protection and using a good topical regimen at home. So there actually is 2 different hand pieces on the Clear and Brilliant. So when we're deciding which one to use, we're kind of looking at what problems are going on with the skin that are bothering you and your skin type and deciding our settings based on those. There's the 1927 handpiece, that's the Premea. That is primarily used for pigment-based issues, melasma, sunspots. You do get a little bit of pore refinement and fine line refinement with it, but it's more geared towards that pigmentation issue. The other handpiece is the 1440. That is the original handpiece. That is geared more towards fine lines, pore size, deeper issues. They feel somewhat similar in terms of the sensation during the treatment. Downtime is probably somewhat similar as well. When we are looking at those handpieces, each of them has a low, medium, high setting on them. We adjust the settings based on your pain tolerance. If you're feeling like it's too much or too little, we can turn this up or down. And we also adjust it based on skin types. We are able to do this on any skin tone of skin without issue. Obviously, we want to be a little more cautious if you have more melanin in your skin to prevent any post-inflammatory hyperpigmentation risk. However, this treatment is very safe and really has not shown me that it has really much of that to worry about. So we are really excited to offer this as a treatment to you, and we look forward to you coming in and seeing what handpiece we would need to use for you and what treatment would work best for you. So if this sounds like something you would like to have a try at, we would like you to come in for a free consultation. We can look at your skin and recommend the right course of action for you, whether that be Clear and Brilliant or something else. So we look forward to seeing you here at Reflections.